A massive shakeup in the effort to get Americans vaccinated after the CDC and the FDA recommend a pause in the use of the one-shot Johnson & Johnson COVID-19 vaccine.
This comes as they work to investigate whether the shot has caused some rare blood clots. Officials say there have been 6 reported cases of these blood clots out of more than 6.8 million doses delivered. All 6 cases occurred in women between the ages of 18 and 48, and their symptoms developed 6 to 13 days after receiving the vaccination. One of the women has died. Johnson & Johnson issued a statement saying, quote, "There is no clear relationship between these rare events and its vaccine." The director of the U.S. National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, says the effort to further understand the situation is now underway.
You want to make sure that safety is the important issue here. We are totally aware that this is a very rare event. We want to get this worked out as quickly as we possibly can.
New York State has paused the use of the Johnson & Johnson vaccine out of an abundance of caution. Governor Cuomo saying he's optimistic this will not severely damage the state's efforts to vaccinate the public as quickly as possible.
When they finish doing their work on the Johnson & Johnson, we'll resume using Johnson & Johnson. But we do have enough Pfizer and we do have enough Moderna vaccination to keep our schedule and to keep those numbers happening.
The pause of the vaccine is leaving many concerned for a number of reasons. We have team coverage for you on this evening. Christian Garzone has more on what it means for SUNY schools who had planned to use the vaccine to inoculate students. We'll get to him in a moment. But first, let's turn to Kayla Green with an important update, Kayla, from local health officials.
Maureen, local doctors say, again, this is incredibly rare, but anyone who did receive the J&J vaccine in the past 3 to 4 weeks are advised to monitor their symptoms. However, Dr. Mendoza says the risk of getting COVID-19 is far greater than the risk of this side effect. 1 in a million. That's how many people have experienced the rare blood clot side effect after receiving the J&J vaccine. Dr. Michael Mendoza says it's possible these 6 people may have developed the clots without even getting the vaccine.
Right now we have an association that we need to understand. We need to see if the vaccine was in fact the cause of these side effects, but we don't yet know that. So I don't think we need to panic.
Dr. Ed Walsh from Rochester Regional Health says the clotting issue has affected 6 women under age 50 with low platelet counts. He says the patients experienced persistent headaches and abdominal pain.
It's a very rare event. I wouldn't lose any sleep over it. I would pay attention to symptoms and not ignore them. Should you have them.
Dr. Mendoza says the blood clots developed in close proximity to each other.
Those who have gotten the vaccine more than 3 weeks ago have nothing to worry about. We are advising anybody who has gotten the vaccine within the last 3 weeks to pay attention to your symptoms as you ordinarily would.
The CDC says this pause may only last a few days. Both doctors encourage everyone to get the Pfizer or Moderna vaccine while this one is on pause.
Clearly, the risk of dying from COVID far exceeds the risk of dying, say, from one of these very rare 1 in a million events.
Dr. Mendoza says that the county is working on rescheduling people who were supposed to get the J&J vaccine to get the Moderna or Pfizer vaccine, and he says that they will keep everyone posted as they work on that. He also says they weren't scheduled to give any J&J vaccines this week in Monroe County, but any that were left over from last week will be stored. Live in Rochester, Kayla Green, News 8.
All right, Kayla, thank you. Let's turn now to Christian Garzone with more on what this means in the effort to vaccinate young adults. I mean, it was a race to inoculate all of these college students across the state, Christian. They were going to use the Johnson & Johnson vaccine. What's happening now?
Well, like many have said, the Johnson & Johnson vaccine is one and done. That's why some SUNY schools, including Brockport, decided to go with that for students. Brockport is saying they want to wait right now and let researchers do what they need to do. This pause is very important. In the meantime, they say they are going to look at other vaccine options. John Falaco with SUNY Brockport says they heard about the FDA's pause on the Johnson & Johnson COVID vaccine this morning.
And SUNY decided to collectively throughout the state at all SUNY campuses immediately paused distribution of the Johnson & Johnson vaccine.
He says for the student population and the community, it's a setback.
However, they understand that the health and safety of our community has been at the forefront of our plan since the very beginning of this pandemic.
But he says so many are still looking forward to getting vaccinated and getting back to normal. He says they are currently pursuing other options like Pfizer and Moderna.
Monroe County has some appointments available. The folks that I'm hearing from have been resourceful.
Like many others are doing, the best move right now, he says, is to stop.
And wait for the scientists to do their thing and determine if we can move forward.
The plan is to still get everyone back to the classroom next semester.
And we're really looking forward to hopefully getting back to being able to offer that in the fall.
Now, at this point, a vaccine mandate at all 64 SUNY colleges has not been implemented just yet. From SUNY Brockport's downtown campus in Rochester, Christian Garzone, News 8. Adam Maureen, back to you.